Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, Malacanang believes it's too early to remove the COVID-19 alert level system. Amid the high vaccination coverage in Metro Manila, some are pushing to require a booster shot certificate before entering establishments. And the health department says the government's policy shift is geared towards learning to live with the virus. Presidential Advisor for Entrepreneurship, Concepcion, joins us live. While the government is making a pandemic exit plan, should the alert level system be scrapped in areas with high COVID-19 vaccine coverage? As Carolyn Bonkin tells us, health officials are adamant the classification is here to stay.
Much like public storm warning signals, an alert level system is in place this pandemic. This system determines relaxations and restrictions depending on the spread of COVID-19 infection and hospital care use. But with increasing vaccine coverage in major cities, Presidential Advisor for Entrepreneurship Concepcion says it's time to forgo the alert level system in areas with at least 70% vaccine coverage. Much like in the US, Concepcion says,
katulad dito sa Amerika, walang alert level dito. But we're moving right now, going out in restaurants, vaccine cards are mandated. Number two, there is social distancing, wearing a face mask. So there is a basic minimum health protocol set up without any alert level. When you're sick, you stay home, you get well, and then you go out.
On that note, he recommends that presentation of booster shot certificate must be mandated in Metro Manila.
Kasama po yan sa mga pag-aaralan at i-discuss as we transition from the pandemic framework together with the entire world to a more endemic way of handling and mitigating the risks of COVID-19.
Dizon says most cities in Luzon already have over 70% vaccine coverage. To build a wall of immunity against the virus, the government aims to vaccinate 90 million Filipinos by end of the Duterte administration and give boosters to over 72 million people. But health officials are not buying the proposal, saying alert levels are not tied to vaccine coverage.
Evolving po ang situation. Hindi pa ho natin alam kung ano mangyayari in the future. We should always be prepared. That's why the alert level system is here. We can always stay at that lower alert level, pero pag dumating na tumataas na naman ang kaso, ito pong alert level system na ito ay gagana at makakapagbigay ng guidance kung kailangan po natin magkaroon ng mas mahigpit na restrictions because tumataas ang mga kaso.
The alert level system is there as a fail-safe na para, kasi kung tanggalin natin sila agad, anong gagawin natin kung biglang mag-spike yung kaso? Inasasarado ba natin? At least yung metrics po natin ngayon, makakalibrate po natin yung response depending on how fast things are going.
The World Health Organization reminded countries it is premature to either surrender or declare victory over COVID-19. Carolyn Bonkin, CNN Philippines.
And let's go straight to the source of the story. We have Presidential Advisor for Entrepreneurship, Concepcion. He joins us live from San Francisco in the United States. Secretary Joey, welcome to the source. Thank you for your time.
Good morning, Pinky.
Okay, it should be about what, 6 p.m. there right now?
About 5 p.m.
5 p.m. Okay, so thank you for your time. I want to start the conversation with this. I read that you want to meet with the private sector and discuss a COVID exit plan. Has there been a meeting? And if not, when will this happen? And to follow up also, what are the key points that need to be discussed with this COVID exit plan?
So we're scheduling a town hall with the private sector. We have started some discussions already since the very start. Now we've been quite aligned with different groups in the private sector. As you know, we've been in the forefront, Bonegosio, myself, in trying to open up the economy safely ever since 22 months ago. No? And the discussions are ongoing, and we will structure this in a proper town hall meeting so that we can share our different thoughts, no, from the different business organizations. But the other day, in another interview with Secretary Vince Dizon, and I was told during that interview that even Secretary Galvez and Secretary Vince are looking already at the preparation towards an endemic scenario. No? And we're not all saying that this endemic is 100% sure to happen, but it is most likely to happen. And Vicky, as you know, last year, the private sector always likes to plan ahead and prepare for the good or the worst, no? And we locked down early last year, and we saved the fourth quarter, and that's why the GDP of the Philippines went up to 7.7. So we have a couple of months remaining under the Duterte administration, and I'd like to see the administration really come in strong with a strong finish on the economy this time, no? And of course, not destroying the gains that we made in our health, no? I mean, so we would like to see the first and second quarter, the remaining 2 quarters of this administration, come out with a very strong finish in GDP numbers, hopefully in the 6% levels, and build on that momentum. And we'd like to see that eventually, when I say, I didn't mean by totally scrapping the alert levels. Maybe that's just a exasperation on my part. What I'm trying to say is that, like in typhoons, in bad weather situation, we don't maintain signal number 1 every day. We only take it up when there is something wrong coming up, whether it's a depression or whatever, then we raise it to 1, 2, or 3. But we never keep typhoon signals all the time at level 1. No? In the same manner, what I've seen here in America is that there are very basic protocols that all business establishments have to follow, no? In terms of capacity of the restaurant, in terms of vaccination cards and now booster cards, and the like. No, and of course, everywhere you go, you see alcohol. You see the same thing that we're doing in Manila. It's also being done here. No, and although I have to say that they're quite strict here with vaccination cards. No, especially when you go into watching a game, mask and vaccination cards will always be checked with you. No, including your identification. So what I'm trying to say is, I think Secretary Galvez and Vince get the point that we're trying to want to see. No, what is this? What do you call this basic norm that we have to establish, whereby assuming Omicron is there but very muted. So do we still call that alert level 1, or do we just say there is no alert level 1 now? This is basically the normal way that we have to live with the virus, no?
So let's clarify that, Secretary Joey. What about a new normal and then still keep the alert levels 1, 2, 3, 4, 5?
That's right. You can still keep the alert levels 1, 2, 3 up to whatever number you want, but use it only at the appropriate time. When things are normal, and there are, in fact, if you were to look at the infection levels in America, they're not low. No, they're still somewhere maybe equal to the Philippines, but there is no alert level here. No, everybody is careful. Yes, people get infected. I mean, but then they self quarantine at home. They get well, and then eventually they go out. No, so it's become like a normal thing. No, to accept that, like a flu. No, maybe stronger than a flu. And people just move their own way. The hospitals are not hitting capacity in the Philippines. At the height of Omicron, our hospitals were barely at 50% as well. No?
While that is true, it's also known that looking into the Omicron variant, it's known to be more infectious, but it's not as deadly as Delta. So really, what do you want to see in the next couple of months? Is it a proactive approach into what could be the new normal?
Yes, I think we have to, look at what is the new normal. What is the desired restaurant capacity that would maintain, this normal way of living? Wearing a face mask, there's no objection of keeping that, whether indoor or outdoor, and the like. And the list goes on, and that's why the discussion within the private sector is important, no? And of course, Secretary Galvez and Vince are also now open to the idea of looking into it. what I'm trying to say is that if there is no imminent threat, and maybe the sub-variant of Omicron is still lurking around there, let's live life normally. Let's move on. Let's allow people to go into open up more business establishments, like similar to what we did in the tourism. We got rid of the quarantine. We are allowing foreign tourists and business people to come to the Philippines. That's what we need to do. No, we have to open up. We have to stimulate the economy through mobility, and of course, we have to open school. No, that's another thing that we have to look into. Hopefully, by June this coming year, as the normal thing is summer break is coming out, and towards June school opens. We have to prepare that our kids are vaccinated, and so is the teachers. No, so that we have at least start opening up schools face to face. Many of their children are not able to get to school in the last 22 months. No, so that's
Okay.
sad that they'll miss 2 years in high school. No?
So basically, after this, siguro this talk on, you said already a while ago, no, just to be clear, it's not really scrapping, tama ho ba, the alert level system, but possibly going to new normal plus alert levels.
Correct. A new normal plus
Okay.
alert levels. But
Okay.
you don't leave the alert level all the time there, like we leave it at alert level 2, alert level 1 indefinitely. So we're forgetting what is the new normal now? What is that moving on protocol that we have, the basic minimum protocol, without calling any alert level, no?
Yeah, but the alert levels are there. Do you submit because of the fact that it's not just about vaccination, it's also about variants that may evolve, guide to the public on what the alert levels are, and
That's right.
automatically that puts into what restaurant capacity, which industries can open up, etc. So
That's true.
do you, when you talk about NCR, when we talk about NCR, because I remember a conversation prior to or during the last quarter of last year. You were pushing government to really bring down the alert level system because you wanted the economy to open up, especially during the last quarter, coming Christmas season, so that there will be economic movement. No, there will be the economy will start to grow during the last quarter, which is exactly what happened. How do you see NCR, Metro Manila, having the highest vaccination rate right now? Where should we be possibly in March or even April?
Well, towards April, I feel that we can do away with even alert level 1 and move to basically no alert. Maybe I'm trying to really drive the point. When we see a tropical depression come in, we don't put up signal number 1. We allow the depression to come in, and we live the normal way as a typhoon. But when we call it signal number 1 or 2 or number 3, then we prepare more. So that is the same thing that should happen with alert levels. There should be no alert levels wherein there is no serious threat to the health situation. Then take it up to alert level 1 or 2 or 3, or even straight to 3 if there is something that is going to be a strong variant that will hit us. No.
Okay, now we need to take a very short break. We will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Presidential Advisor for Entrepreneurship, Joey Concepcion. Secretary, let's talk about booster shots. Are you looking at a scenario, a situation in NCR wherein the primary vaccination card or primary vaccines would not suffice and booster shots would be necessary in order to enter establishments or even workplaces?
That's right. At a certain point in time, the first and second dose of our initial vaccines will wane off. And that's why the Philippine FDA and DOH has brought down the booster shots to 3 months from your last dose, which is your second dose. No? In America, it's from 6 months to 5 months. So in the case of the Philippines, we did it at 3 months. And for whatever reason, I guess they want to maintain, as Secretary Galvez calls it, a wall of immunity. And I agree with him that we cannot allow a break in the immunity of our citizens, no? Because once that happens, then all what we did in vaccination would just destroyed, in the sense. And we don't want to see that if there is a variant that comes in and the surge happens, that many are technically left unvaccinated, because the vaccines do wane after months, and some are 4, 6, depends. So the intention really is to remind the people that as it comes due, your booster shots, take it. Now, the DOH brought down it to 3 months in December. So the private sector really has only started this January. Most companies have been inoculating their employees with booster shots as we speak, and it will continue. So the requirement for vaccination cards need not be now. Eventually, just to ensure that the population remains conscious that they have to take the booster shots, then we have to ensure that when they go out to these business establishments, similar to the vaccinations that we took earlier, that vaccination cards will be required.
Yeah.
And in this case, it's not anymore vaccine; it's still a booster shot, a booster card.
But at what point do you think this will be necessary?
Well, I think when the percentage of booster shots would have at least maybe 50, 60%, then especially right now that there are a lot of vaccines in the country as we speak, over 100 million vaccines, which are being used as booster shots. We have to bring, there has to be a sense of urgency, for people to take their booster shots. Some people might even forget that they need to take the booster shots. Some people may say, okay, I won't take it 3 months, maybe I'll wait till 6 months. So that can happen. So if we want to help Secretary Duque put up that wall of immunity, then the consistency of the immunity has to be there.
Okay. Very quickly, I wanted to ask you, just your thoughts very quickly on this. Transitioning into the new normal with cautious optimism, of course. How do you see workplaces adapting to this? Are you still seeing, just moving forward, continuous work from home for some of the employees? Are you looking at structural changes in workplaces so that there will be more ventilation with or without COVID-19?
Well, right now, for example, our company, we're 3 days work from the office and 2 days work from home. Eventually, we'll move this to 4 days, Monday to Thursday, work in the office, and 1 day work from home, which is a Friday. So that is how we are looking at it as we see the cases go down. And I think it depends on each company on how they would like to approach it. Each one has that flexibility. If they want to give more work from home, it's up to them. If they want to give more work from office, it's also up to them. So I think each company will adapt. I think we have to trust that over the past 22 months, our Filipino people more or less know how to protect themselves. And of course, the private sector as well, they have their own protocols already. And I think we should give them that leeway.
Okay. All right. Presidential Advisor for Entrepreneurship, Joey Concepcion. Sir, as usual, thank you for your time.
Thank you, Pinky.
And coming up, what happens now after the retirement of 3 COMELEC commissioners ahead of the 2022 polls? Former Commissioner Louis Guia will be with us after the break. Please stay tuned.